Hi, and welcome to the Owatonna Today Show. I'm Shelley Whitehead. Thank you so much for joining us right here on Charter Channel 181, where you can see us 6 days a week, several times throughout the day. And the show can be found on the internet. We are on YouTube under Owatonna Today. We also are on Facebook, and when you like us, Leanne does upload the most recent episode right to your news feed. And you can follow us on Twitter. Our handle is at Owatonna Today. We do always welcome your comments and suggestions for show topics. You can let us know at Owatonna Today at charter.net, or you can call Leanne Alt, our producer, at 390-5751, and we'll see what we can do to get you on the air. Thanks so much for joining us today. We're going to be talking about health. It's all about public health, so stick with us. We'll be right back after these messages.
Hi, I'm Jody Voisin with the staff at Fairview Animal Medical Center, your other family doctor. Fairview Animal Medical Center is a proud supporter of the Owatonna Today Show.
Juvenile fire setters cause a lot of problems with young adults and children in our community. To help people and parents or anybody with their juvenile fire setter, we have a program down here that will help you get information to pass on to your juveniles and young adults about fire setting and the common problems with that and the dangers of juvenile fire setting program. This is a public service information from the Owatonna Fire Department.
And we're back to the Owatonna Today Show. In studio, I have with me Jane Nyquist and Karen Fountain. Thank you, ladies, so much for joining us.
Thank you for having us.
I would love it if you do me a quick favor, though, and introduce yourselves.
Okay. I'm Karen Fountain, and I work in influenza vaccination and disease and prevention control at Steele County Public Health. That's a mouthful.
It is. Your card must be really long. And go ahead, Jane.
I'm Jane Nyquist. I'm a health educator. I've been with Steele County Public Health about a little over 14 years, working on grants, prevention-related grants, and right now tobacco and obesity prevention grants.
Good. Well, thank you, ladies, for being us. Jane, we're going to start with you, actually, Karen. We're going to start talking. Give us a quick update. Last time we talked a little bit about the influenza, and it touched on Ebola. Tell us what's going on with those two diseases, just in a global generalization.
Okay. Influenza illness has been really high in the elderly this year. In fact, it's been the highest rate that it's been since the Center for Disease Control has been tracking influenza. So we know that the vaccine this year wasn't as effective as we would have liked to have been, and we're seeing the ramifications of that in the number of elderly people that have become ill and had to be hospitalized. So one of our takeaway messages is we all want to protect the elderly. One way we protect the elderly is by the rest of us getting vaccinated, and when we're ill, staying home, and then reminding everyone, excuse me, to use good hand washing, to cover your cough when you cough, and also to disinfect commonly shared objects such as doorknobs,
Carts at the store.
Carts at the grocery store, those sort of things.
And what about Ebola? It just kind of seems to have dropped off the face of the news feed, hasn't it?
Yes. Ebola is still a problem in Western Africa, in Liberia, New Guinea. The good point is that there are some vaccination trials that are beginning in Western Africa, and we're in hopes that that is going to help to control the disease. The Minnesota Department of Health is continuing to monitor people that live in Minnesota but have traveled to the affected countries, and at the moment they are monitoring 47 people. So that means 47 people that live in Minnesota have traveled to the Ebola-affected countries. They've returned to Minnesota, and they are under no isolation or quarantine. However, what happens is local public health or the Minnesota Department of Health, someone will contact these persons daily, chat with them, and monitor them for symptoms.
And it's about 21 days that they have to do that.
That is correct.
So then after that,
they're considered free.
Yeah, because that's the incubation period for the Ebola thing.
And as a reminder, the monitoring has gone well, and we have not seen any cases in Minnesota.
Great. Good. So. Well, and another huge thing on the news right now is measles, especially since it seems to be spreading at Disney World or Disneyland,
Yes,
which,
yes.
is supposed to be the happiest place on earth, maybe not so much
Yes.
right now. So tell me a little bit about what's going on with these measles outbreaks.
Okay. Last year, in 2014, there were over 600 cases of measles in the United States. That was for the entire year of 2014. So far, in December and January, we have had over 100 cases of measles in the United States. Most of those cases are related to an outbreak at Disneyland in Los Angeles. And what it is doing is bringing home the message that because of world travel, people sometimes are traveling to countries where measles is still, endemic, and because of an unvaccinated status or an undervaccinated status, they contract measles, and then they come back into their local communities, or they go to public places such as Disneyland, and then people that are unvaccinated or undervaccinated, then that makes them more likely to contract the measles.
Well, and I guess there could be a little bit of misunderstanding as what's the big deal, because isn't it just like chickenpox? It's everybody gets chickenpox. Kids, we're vaccinated
Yes.
for it now, but most of us as kids had it. So what's the big deal? And I think we need to
Yes.
really understand that this is quite a big deal.
Measles has always been a disease with very severe complications in certain persons. And many times these are healthy people that have the complications. Even today, 1 in 1,000 people that would contract the measles will die from it.
So it actually can be fatal to
It
certain
can
parts
be,
of the population.
and there can be inflammation of the brain, and that can lead to disability. There are also measles. The measles virus can affect the eye, and so it affects the cornea, so there can be loss of sight. And so because we haven't been seeing cases of measles, I think we forget just how many complications and severity there was when we did not have a vaccine for it.
So many people, I think part of this debate has been based on kind of false information. I know that there was a fear that maybe some of these vaccines might be causing autism or that kind of thing, and that is not founded in any kind of science.
No. The research that, kind of led to that fear has been debunked. It has been shown that it was inaccurate research to begin with. And measles vaccine, which is the MMR, has been in existence for over 50 years, and it is one of our vaccines that has been studied in depth because we want to make for sure that it is a safe vaccine. And all of the research coming out is showing it is a very safe vaccine, and it does prevent measles, and it does then prevent those complications.
And we were talking a little bit about it, how we may think it's a personal choice, me not vaccinating, it's just about me. But if you do get the disease, you
Yes.
can transfer that to people who you mentioned who are unvaccinated or who cannot be. Because there's a certain part of the population who just cannot. And explain a little bit about that.
Okay. Measles vaccine is found in a vaccine called MMR. And that vaccine is given to babies at 12 months of age. So if a baby is under the age of 12 months, they will not have received the vaccine, and they then are at risk for contracting measles if they come in contact with someone that has it. Persons that are pregnant we cannot give the vaccine to them. Persons that have immune system deficiencies cannot receive the vaccine. And so by us I personally think, ethically, we want to see 100% of people vaccinated for measles with MMR who can receive the vaccine. That's how we prevent the illness.
You're protecting other people by
Yes.
doing that. Not just, again, it's not just a personal choice. It is actually a global choice.
Yes.
You're affecting other people.
And people may not realize, too, just how contagious measles is.
How is it transferred?
It's transmitted by aerosol, which means that little droplets get in the air and we breathe them in. And if someone is in a room and they have measles, those little droplets can stay in the air, suspended in the air for up to 2 hours. And so over 90% of people who are not vaccinated will contract measles if they come in contact with that airspace of the person who has been.
So if somebody's watching today, they have not been vaccinated, what's the next step for them to do? Or if they haven't vaccinated their kids
Yes.
because of erroneous information, whatever, what is
Okay.
their next step?
Persons that were born before 1957 have contracted measles naturally, meaning that you contracted as a child because it was so contagious. You caught it in your family, you caught it at school. And so if you were born before 1957, you have natural immunity to measles, probably. And then after that, we were introducing measles MMR vaccine into the population. And any child that was born before 1989, between 1957 and 1989, should probably have their immunization status checked, because we want to make for sure everyone between 1957, born between 1957 and 1989, has had at least one MMR.
Because in that, for those age range, it was, immunizations were not the regimented things that we
That's
have
right.
now.
They weren't necessarily required.
Right.
And so that's, or what was happening, there was perhaps a requirement of one vaccination, but now we have gone to two. Now a prerequisite for admission to kindergarten is to show a history of two vaccinations with MMR vaccine.
And that's what you mean by under-vaccinated. Maybe you
Yes.
have the one but not the second.
That is exactly
Okay.
right. And with one vaccination, it's felt that people might have a protection of about 90%, but once we get that second, that booster, we can get that vaccination rate up to almost 99%.
Okay. Well, thank you so much. So, and everyone after that, born after that, should have that kind of been
Yes.
prompted by their
Yes.
doctor, and if they've chosen not to, we really do encourage you to just talk to your doctor, get the
Yes,
facts.
we
Don't
do.
just go off
We
what you see on
encourage you
social
when
media.
you're
Right.
in talking to your healthcare provider to ask what your MMR status is.
Good. Ladies, thank you. Well, we're going to be right back, because actually we're going to sit and we're going to talk a little bit with Jane about stuff going on, so stick with us. We'll be right back.
Hi, my name is Buddy Ricker, and I play about 10 different characters in this play, including the Crofter and Mrs. McGarrigle.
And I'm Steve Searle, and I play about 9 different characters in this play, and we're both in LTO's current production of The 39 Steps, directed by Linda Karnauskas and sponsored by Jostens and Viracon.
Performances of the 39 Steps will be held Friday and Saturday, February 20th and 21st at 7:30 p.m., with a matinee on Sunday, February 22nd at 2 p.m.
And again the following Thursday and Saturday, February 26th, 27th, and 28th.
If you want tickets, they're available at LTO box office by calling the following number, 451-0764, or if you've got a computer, use it and go into littletheaterofowatonna.org.
1, 2, 3.
Don't
miss LTO's production of The 39 Steps.
Hi, my name is Dave Efforts with TPS Insurance. We're here to handle all your insurance needs. We are a very proud supporter of the Owatonna Today Show.
From ABC's hit show Shark Tank, Damon John, motivational speaker and best-selling author Liz Murray, and legendary actor-comedian Dan Aykroyd. Register online at refreshleadership.com/live.
Hi, this is Doug Johnson at the Owatonna Business Incubator, a proud supporter of the Owatonna Today Show. We'd like to welcome you to the incubator. If you're a small business, whether you're existing or a startup, we can help you with office space, manufacturing our warehouse, and free confidential counseling.
Welcome to Bremer Bank. I am Jason Iberg.
And I am Shannon Pedersen.
Bremer is a full financial services bank.
We invite you to stop by Bremer Bank and experience the Bremer difference.
You are always welcome at Bremer.
Hello, I'm David Einhaus with the Owatonna Foundation. Thank you to all of our donors who have helped make Owatonna a better place to live. Will you join us today with a financial gift? Owatonna Foundation is a proud sponsor of the Owatonna Today Show.
And we're back, and we're going to continue our conversation, talk about public health, and this time we're going to run over to Jane Nyquist. Jane, you have done some grant writing for bringing programs to the Owatonna area to kind of make it a healthier place.
Correct.
So talk to us a little bit about what you've been up to.
Well, first I'm going to take my glasses off so I can actually see, because I can read close up. I don't need my cheaters just yet. I just wanted to share that over the last year or so, there's been a lot of strategic planning that has been done through our agency. And we had to do a community assessment of sorts. Because we're a community health agency or board with Dodge County, we had to do a survey that included both counties. So we did kind of a random sampling survey and asked about health priorities for our two counties. And the top 3 health priorities are something that we will be addressing in our agency.
So these
or
are the
we're
things
already.
that the public have said, these are the
Correct.
top 3 things that are important to me. Okay.
That's correct. Obesity and overweight. We've got high rates all over the United States. So that was one that came out on the top. Mental health issues came out second. And that is something, again, we're seeing very much in our agency. Not among staff necessarily, but yeah, sometimes.
Depends on the week.
It depends on the week or the day with clients. So,
Yeah.
And then the third one was tobacco use. That's always been an issue. Tobacco use is the #1 preventable cause of disease and death in the United States, but obesity is right there. A sedentary lifestyle, probably going to overtake tobacco use, disease, and disability. And so we have grants that I have helped write for our agency. The one that relates to obesity and overweight that we have is called SHIP with a P, Statewide Health Improvement Program. It's a grant through the Department of Health, Minnesota Department of Health, and it looks at improving nutrition in our community, and that is by more fruits and vegetables, reducing sodium, sugar, and added sugar, and saturated fat in our foods. We also are looking at improving our physical activity, kind of building it into our day so that it's not like you have to run to the gym. You can just do it every day by having a community or an infrastructure that's safe to go out and walk or bike or rollerblade or whatever you choose to do. And this particular grant works in 4 areas in the community, which I'll talk a little bit more about. But we also have a worksite component, and we have several worksites that meet every month that discuss how to make their worksites healthier. What kind of policies or system changes or environmental changes that can be done to make it just a natural part of everybody's day to be healthier or more active. We also want to work with healthcare. Healthcare is going towards, instead of a sick care model, they're going more toward a healthy prevention model.
Preventative, yeah.
Preventive, yeah. With the Affordable Care Act, they're really looking at, they used to pay for how many visits or how many tests or whatever, or got reimbursed. Now they're looking more at getting reimbursed for doing more prevention type things. And so we work with healthcare a little bit, and then also schools. Again, to look at the nutrition, to help them with policies or system changes, environmental changes.
So you're really in the beginning process of this whole grant. So you've written the grant, you've gotten the grant. So now you're just going to start the research process.
Well, we're doing the work.
Okay.
We had SHIP 1 actually. We're on SHIP 3.
Okay.
We had SHIP 1 about 4 years ago.
Okay.
We did not get SHIP 2 because they didn't have the legislature didn't allot enough funding to do SHIP 2 for our county. Some counties did get it. Now we're on SHIP 3. We're trying to implement, we're building relationships, we're talking to those 4 different sectors or segments of the population to see what their needs are. And with the community, we're looking at things, say for the nutrition component, we're looking at things like community gardens, working on emergency food shelves. We can look at convenience stores, grocery stores, making sure healthier food is accessible to all. And we've been working with United Way in the hospital. They also did an assessment, and this came up on their radar screen too, looking at what can we do to make to make healthier foods more accessible to everyone. Transportation's been an issue, so we're working with the United Way Health Committee on trying to solve some of those issues. But we're working on that with that group of people, but we're also looking at the active living. How do we create a culture in our community or in our county that it's safe to walk, people want to walk and bike. We are not a huge geographical area. We can walk to a few stores. Maybe we can't walk out to Walmart from the center of town, but we have, well, if you look at Target as a grocery store, we have about 6 grocery stores, so maybe we can walk or bike. So we're trying to look at how do we make the culture more where you do maybe walk to get some groceries or bike to get some groceries, walk to work, walk to church, get kids walking more, maybe have something called a walking school bus where maybe a parent or a volunteer walks with the kiddos to school in a group, so the parents feel a little safer sending their child off. And so we're really looking at how can we make our community more active. And so we're really just baby steps. We're trying to build a relationship.
Well, does it feel daunting at this point, or are you basing it off of maybe some of the communities and the models that they've created, or?
Yes. There's a lot of evidence-based research that's been done, programs and curriculum, different things, and so we're definitely using everything evidence-based. So anyway, that is kind of the obesity part of the thing we're working on. The other thing is I have 2 different grants that are tobacco related. One is called Tobacco Free Communities, and we are really, and that's a Minnesota Department of Health grant. That one is, we're here to serve as a resource to anybody who owns rental property, landlords, managers who are maybe considering going tobacco free in their rental property. The Minnesota state law, the Freedom to Breathe Act of 2007, did not, we had a little distraction here.
There it is.
We did, the Minnesota 2007 Freedom to Breathe Act did not make it mandatory for rental property to be smoke-free indoors.
Because every other public place, but they're considering that because it's a private home.
It's a private property. All the common areas in, say, a big apartment complex, all the common areas have to be tobacco-free, but the individual's unit doesn't. But what we've found through a lot of research and testing is that any kind of smoke, but cigarette smoke in this case, can infiltrate through little cracks that we may not know are there. And so we're here to help anybody who might be interested in going tobacco-free. We've got a lot of research. The Tobacco-Free it's called ANSWER, Association for Non-Smokers' Rights out of the Twin Cities, has done a lot of cutting-edge research on this. So I just want folks to know that give me a call if you're interested in anything on tobacco-free rental property. Another thing, the other grant that I work on it's from Clearway, Minnesota. Clearway was part of the tobacco settlement in 1998. They were an organization that was to do tobacco work for 25 years, and then they were to sunset. And they are funding our grant too, and we're looking at education, we're looking at tobacco-free outdoor environments. One thing out of that grant, or 2 things out of that grant that I'd like to really promote is, one is they have Quit Plan services. It's a cessation program that they have developed. You can do a call-in or you can do an online program. And I have some notes here about this. Quit Plan is a free cessation program that's available to anyone who lives or works in Minnesota. There are many tools that are available that Minnesotans can utilize if they would like. They would call in, they would complete some questions, they would get some coaching sessions online, and then they could also get free nicotine patches, gum, or lozenges. And then, let's see, it's available to anybody if you don't have insurance too. If you have insurance, they'll probably funnel the payment through that. So Quit Plan, I want to make sure everybody knows that is available to anybody who uses tobacco. The other point I'd like to make in the last few seconds here is that electronic cigarettes are kind of a hot item right now. We do not know enough about them to really approve their usage. There's a possibility they could be a very successful tool for cessation, for quitting tobacco. But right now, the research is showing that there are a lot of chemicals in it that we didn't know were going to be in there. And the vapor that comes off is not just water vapor. There are chemicals and things that come off of there too. So just wanted to say that it's really not a safe alternative to a cigarette. A lot of people are dual using, still smoking and still using these. A lot of people are finding that they use these cigarettes and they don't know how much nicotine they're getting because the packages aren't FDA approved or labeled. So they might be getting more nicotine than they were when they were smoking the actual cigarettes. So just want to put the word out there that, it's not the safest product out there.
And if they have more information, they can contact you.
Please call us at the number on the screen.
Good. It's been a pleasure, ladies. Thank you so much. It's been so informative. I feel like I'm much smarter now. Thank you. We'll be right back. Please stay with us.
The 22nd Annual Benefit Concert for the Steele County Food Shelf, Friday, March 6th at 7 p.m., Saturday, March 7th at 3 and 7 p.m., and Sunday, March 8th at 2 p.m. at the Owatonna Little Theater. The 22nd Annual Hometown Sampler Concert will help raise awareness, funds, and food needed to keep the shelves at the Steele County Food Shelf stocked. Admission will be by free will offering of money or food. Find out more at steelecountyfoodshelf.org.
Hi, Warren Abraham, Abraham Consulting Technologies, your one-stop technology shop. We support the Owatonna Today Show.
Owatonna Public Utilities, real people, real reliable, real progress. Making life a little easier day after day, taking pride in our community, listening to what you say, a voice you can talk to. We're growing with you. Owatonna Public Utilities.
And it's time for a quick look at some of your community service announcements. The Steele County Historical Society is bringing in Ann Cummins-Peterson. She is the museum director of the Minnesota State Public School Orphanage and Museum. This is tomorrow at 7 p.m. in the Wenger Room. You can check that out. Admission is free for Steele County Historical Society members, $2 for non-members. The Habitat Humanity of Steele Waseca is inviting individuals to attend one of 2 information workshops. These will review the eligibility criteria and application process for people who may be interested in habitat home ownership. The first one is Saturday in Waseca at Grace Lutheran Church. This is March 7th from 10 to 11:30. And on Tuesday, March 10th from 7 to 8:30 at Good Shepherd Lutheran Church in Owatonna. Looking forward to what's happening on Friday's show. We'll talk a little bit more about that, but it's the Hometown Sampler. It's coming up, and just, again, great music for a great cause, trying to bring in money for the Steele County Food Shelf. So make sure you check in on Friday for that. It is also the 3rd annual Mike Hansen Memorial Washboard Tournament. This is Saturday, March 14th at the Elks Club. This is a new location. Be aware of that. All proceeds from the tournament will be donated to Owatonna Park and Rec Scholarship Program in Mike Hansen's name. The scholarship does provide programs for opportunities for kids to participate in park and rec activities. If you have questions, call Wes Jones at 507-456-4280. And there is the Breast Cancer Superhero Portrait Project coming up March 20th at the Arts Center. It's Friday, March 20th at 7 p.m. And artist Barbara Porwit and one of her superheroes will have a reimagining of the superheroes and kind of give it a breast cancer awareness twist. So thanks so much for joining us today. Again, on Friday, it is Hometown Sampler Day, as well as a talk with Owatonna Business Woman of Achievement event. We'll see you then.